Digital Therapeutics and COVID-19, mitigating the impact of coronavirus on physical and mental health through the use of digital technologies. The coronavirus pandemic is a global disaster of epic proportions. The human race has never previously had to deal with the issues and dilemmas that COVID-19 is now posing in every part of the world. There are so many things that we don't know about this new virus that it is literally impossible to predict the outcomes across every aspect of everyday life. We can only make judgments and take decisions based on previous experience of other pandemics, like the Asian flu epidemic of 1918. But the world in 2020 is very different today. Our expectations of longevity and standards of living are now embedded in daily routines and lifestyles. But these are unlikely to ever be the same for the foreseeable future. The International Society of Digital Medicine, or ISDM, was formed in 2016 in Nanjing, China, as an initiative to share knowledge of best practices and shape the development of digital technologies to support better and more sustainable good health and well-being for everyone. This not only includes understanding how digital technologies can be used in medical practice to diagnose and develop remedies for medical conditions, but also to develop preventative healthcare solutions that protect and maintain health and well-being. The urgent nature of providing diagnosis and treatment of COVID-19 is naturally a priority to ensure that public health systems do not collapse under the pressure of a rampant pandemic. This places a focus on the impact of COVID-19 on patients suffering from the condition. However, there should also be a recognition that the social isolation and lockdown measures being put into place to limit the spread of the disease is and will be having a significant impact on the physical and mental health of all citizens. This ISDM webinar aims to discuss ways in which digital technologies can mitigate the impact of coronavirus on the physical and mental health of citizens during the current crisis and afterwards, when society tries to recover from this devastating blow to human life. Panelists with recognized expertise in the use of digital technologies as a physical and mental health therapy are being invited to share their experiences in the form of video interviews, a webinar, a virtual conference focusing on knowledge sharing and networking. This webinar and virtual conference is part of a series of such digital medicine events, and we hope will help to mitigate some of the problems we face both now and in the future. And we very much hope that you will join us for this webinar and virtual conference and participate as a panelist if you feel that you have something to contribute to the discussion. Thank you.